Perfect. So, say you have written a histopathology report with your hand, the IDC, T1, T2, so it automatically structures it into format where you can use it for future use also.
So structured data, that is what, so I'll not go into these things. I think we have already discussed this in detail. So finally, I'll just go through this small video presentation. We were talking about Oncflow. So this is basically a AI which we are using, AI-based digital workflow station, where you can have a very intuitive look into your patient's journey if you are collecting your data properly. So it will give you when it was registered, what were the diagnoses, what were the treatment plans, and the very important thing now they have come up with is a keyboard liberation, where, for example, for when the front desk is registering a patient, he just upload the ID. This is my ID, which I have for demonstration. I'm using it, and it will automatically extract all the information into your forms, registration forms. So this is something which, as a doctor, we always need some sort of a keyboard liberation, where you don't have to type everything in your system. So this is an auto registration process where the front desk adds everything, and again, when front desk uploads some document, usually oncology patients, they come with many documents. For example, this patient with some PET scan reports, some biopsy reports, some CT scan reports. So everything is being uploaded by the front desk, and as patient reaches to the doctor, it usually takes 10 to 15 minutes from the front desk it reaches to a doctor. Then at that particular moment, when doctor goes to its routine clinical practice, a routine clinical visit module, there he can actually, auto-generated summary is being created, and you can have a short synopsis of that summary. This is all generated by AI. And it can also, if the information is sufficient, it can also do the TNM staging of that particular patient. You can actually choose if you don't want that kind of a long summary, you can actually choose which document you want to use, and you can regenerate the summary in a medium format. Similarly, that's a modified summary here. And in the meantime, when you go to a clinical visit where you want to prescribe some drugs to the doctor, this observation field is automatically filled by whatever the reports and everything has been submitted to that AI model, and then you routinely actually put all your observations and investigations and prescriptions. This again is going to change also. In fact, now there are tools, probably these Dashamlav guys are also coming up with that tool, where you can record ambience noise, and from that ambient conversation of you and your patient, it can actually fill all these things, prescriptions and everything, whatever you're talking. And again, this will be a true keyboard liberation kind of a thing, and this is a prescription, a digital prescription. We can actually just print it and give it to the patient. And similarly, this patient, when comes after a follow-up of 1.5 months or 2 months, 3 months with a new PET scan report, so this will not create a new summary. Actually, it will append to that particular the prior report, which is again a very informational kind of a thing. You can see here that it started generating, and in this scenario, you can see that it saw the last report and reported that there is no evidence of metabolically active disease. So still the patient is in remission. So this is all done automatically. The only thing is you have to upload your documents. Somebody has to be at the front desk who is uploading these documents. And then you can get a nice overall journey of a patient in a properly structured summary. Once you have summary and you know that this is the final summary, this is the probable diagnosis which AI model has done, then you have to validate those fields. Because the very important point here is doctor is always in the loop. It is not everything which is being done by AI. AI gives you something, you validate it, and then it can create a care plan for that particular patient. It can tell you, okay, these are the standards which should be done. Then you can go through it, you can revise it, you can edit it as per your practice, and then you validate it, and then it can be saved. And every time when patients come in your clinical visit module, you can see, okay, this was a probable diagnosis, this was the care plan which was generated, I am going through this care plan. So you have a very clear picture of that particular patient when it comes to your clinical visit. So you don't forget anything. So this is always, we have to go through files and everything. The other aspect is AI-enabled research assistant, data retrieval, as we were talking about. So first and foremost thing is, if my data is like breast cancer patients, so it will give you all the recently published article from the PubMed. You can directly click and go there. So it will tell you your practice-oriented medical literature which you actually are doing in your practice. So it will just give you only those things. Then you have a team form discussion forums here, which is only for your particular team, which team is using Oncflow, and you can have some sort of a discussion between your team, what latest thing which you are using, what are the recent papers which are there. And when you want to retrieve data, there are two ways of retrieving. Is a simple filter-based thing where you select, okay, I want breast cancer patients. This will give you all the list of breast cancer patients which you can see here. Its limit is only 1,000, but we had more than that patients. And then you can click and visualize your data. This is all done by AI. So you have a broad data with you. Then we want to pinpoint and focus what's there in that particular data. This is a very simple example. I just asked, this is like a chat-based system where you can ask, you have a data and you can talk to your data. You can ask, okay, show me the distribution of patients as per the disease site, because this was only for the breast, so this will be 100% of the patient will be breast. It will generate a graph for you. Similarly, if you ask about the different disease sites, different techniques and different grades of tumors, so it will give you and generate a particular graph for you. Not even that, so I'm just giving a very simplistic picture, but again, it depends what kind of data you are entering, because this is only possible if you are entering your data. So if you enter your data, it will give you all sorts of distribution automatically into your system. Another very important thing is here, you can actually query your data with just a natural language. Okay, show me all the simulations with IGRT technique. I just put that, and it will give you all the patients with all IGRT technique, 843 patients. You just have to save it in a CSV format and do analysis in any of the statistical software which you want. So like for example, where we have given number of fractions less than 5, so it will give you that. So whatever you can think of, you don't have to know any programming, you don't have to know anything about the coding, you just write in your natural language and it will generate data out of your whole data set which you have prepared in this particular forum. So similarly, there is a simulation dashboard, which again is a very important feature which we found out, because among our team members, everybody is aware of where the plan exists, whether it is in the planning phase, whether it is with the physicist, I am sitting in the OPD, and anybody can change the status of this. You just go here and you can change. Okay, now from contouring it has gone to the planning, and it is now ready in a particular machine. Similarly, these are again the structured data. You have a histopathology report, you submit it to the LLM, it will actually go through that whole histopathology report and extract exactly the information which you need, like the tumor size, and it will give you a context from where it is picking out that information. Similarly, you can have a DVH. That's a very important thing for us when we want to do any kind of a dosimetric analysis. You submit a DVH and then it will extract all the relevant information from the DVH, whatever you want, and then you can save this data with you, and this data remains with you. Whenever you want to do any sort of analysis, you can do that kind of analysis. And this is again this is again a very intuitive, interactive and live dashboard. As soon as you are entering your data, this dashboard is getting updated. So here you can see the distribution as per the breast, the subsite of the breast, and what technique you are being using for that particular breast cancer patients. And you can actually go through your data on the basis of the primary or a metastatic site. Similarly, the follow-up assessment, year-wise or a month-wise. What I was telling you is, okay, once I see in this particular month what kind of toxicities I was addressing, and maximum was grade 3 radiation dermatitis, what maximum toxicities were there, what kind of toxicities were there. Similarly, the follow-up, what patient relapsed in that particular follow-up. So this again is a very intuitive, at one press of a button you get everything. So with this, I would like to thank all the panelists. I think we are being hounded by the organizers, so we have already actually crossed the time limit. And I would like to thank all my panelists for a wonderful discussion. Yeah, Dr. Ashok.
Does this tool has statistical analysis tool also integrated into it?
Not really right now. So with this, no, right now it is not there. This is a simple statistics. So you collect data and then you can do statistical analysis, but later on, obviously it can be done. So with this, I would like to finish the panel discussion here, and I would like everybody to be seated here because inauguration is going to happen after just after this. Yeah. Thank you, Dr. Suman.
Thank you, sir. Thank you, sir, for the mobile.